name's Patty David. I'm a licensed physical therapist and owner of Health Source of Chandler South. I put together a series of exercises for individuals who have suffered from back pain and are ready to start strengthening their core. It's critical before beginning these exercises that your back symptoms have resolved and you're not suffering from any sciatic symptoms. Please do consult with your healthcare practitioner to make sure that this series of exercises is right for you. To get started, what you're going to need is a 55 to 65 centimeter ball and a medicine ball or a 3 to 5 pound weight. Let's take a look at your range of motion first. Bend forward as far as you can. Coming back up, support your low back, bend back as far as you can. Coming back to the center, shift your hips off to the left as far as you can, and then to the right as far as you can. As long as there was no pain, you're ready to warm up your back and get started. We're going to do 10 extension exercises to warm up the back. Keep your lower back relaxed. Your arms should be doing all the work. If you're having trouble relaxing your hips, turn your toes inward. If there's any discomfort, stay within a lower range with this. Let's do about 3 more. Now that the back's warmed up, we're ready to begin our core exercises. We're going to start with the plank. Each exercise is going to be 40 seconds with a 15-second rest break. Starting on the forearms, you want to make sure to pull your abs in, head neutral. If you're having difficulty, start on the knees. Make sure to maintain a flat back the whole time. We don't want the hips rising up or collapsing down. Nice and strong, keep pulling in. I am looking for quality of the exercises, not quantity. Great work. For the next exercise, you will need your ball. Lie on your back. Bring the ball under your knees. Bring it as close to you as you can to start. Abs tight, lifting up towards the ceiling and lowering down. Only go within a range that's comfortable. So to start, you may only be going halfway up. If it feels easy and you want to challenge yourself, move the ball out farther towards the ankles, increasing that lever arm between the pelvis and the low back. All right, now we're ready for our next exercise. And with the next exercise, we're going to be using either your weight or your medicine ball. Back on the floor. Here we go. Legs up at a 90-degree angle. Tightening the abs, bringing the ball or the weight overhead. Control the movement. If that feels like too much strain on your lower back, bring the knees in closer towards you. That will help to alleviate the pressure. On the other hand, if it feels easy, you can open up that hip angle. Still looking for more of a challenge? Slowly lower one leg down at a time as the arms come back up overhead. Good. Set your weight or ball aside, and we're going to come onto your hands and knees. You want to make sure for this exercise that your shoulders are in line with your wrists and that your hips are in line with your knees. Abs tight, stretching opposite arm and leg out. If you're having trouble balancing, just start with the legs. Abs try to prevent any rotation from the lower back from occurring. As that feels better, then start to incorporate the arms into the movement. Good. Moving on to side planks. Pick a side. We have to do both. Again, alignment. We want to make sure that our shoulder and our elbow are in alignment. Make sure that your hips, knees, and ankles are on one line as well. Lifting up, we're just going to do an isometric hold. If you're doing this and you're noticing too much strain through the back area, start with the knees bent. Again, shortening that lever arm. Come up to a controlled position. Make sure to pull in the whole time with those abdominal muscles. As you get stronger, then progress back to being onto the feet. If that feels easy, raise the arm up overhead. Doing great. Hold tight. And switching to the other side. With this, you may notice that one side does feel easier for you than the other. That is normal. So you may want to start with the knees bent on the other side to see how it feels first. If this feels okay, then you can work to progress it to coming out with the legs extended. Remember, hold nice and tight, abdominal muscles in. As it feels good, raise that arm up towards the ceiling. The challenge with these exercises is you have to consciously think about pulling those abdominal muscles in. Stay strong with me here. Okay, we're going on to our stomachs. Arms and legs extended. The challenge with this is keeping the tummy muscles tight the whole time. We're going to be alternating our opposite arm and leg. Good. As you're doing this, remember, keep those abdominal muscles drawn in. If you have any trouble reaching with the arms and the legs at the same time, just start with the legs. Okay, we're ready for our ball again. For this one, we're going to be in a partially planked position. So on the knees, forearms resting on the balls, abdominal muscles tight. The only thing that's moving is my arms. My arms move out and coming back in towards me. Nice and easy, controlled movement. You should feel your abdominal muscles at all times. Do not let the back sag in as you're doing this. If it feels easy and you want to challenge it, come up onto your feet. Again, increase that lever arm, make it more challenging. Okay, last exercise, so important. We're going to work our back extensor muscles. Find something solid. You can put your feet up against a wall, a couch, a chair. You're going to put your hips on top of the ball, arms across the chest. Use your back muscles to pull up. Do not squeeze your gluteal muscles. Use your back to help to lift you up. These muscles are so critical. They helped us with all our bending and lifting activities, often neglected when rehabbing the back. It's normal in this exercise to feel some tensing up. Take breaks with this one as you need and build up slowly. That's it. We made it through the exercises. We're going to do another set of 5 of the press-ups to cool down here. Make sure that these feel as good as they did when we first started. Excellent. I want to thank you for joining me through these exercises. Again, remember to take your time when you're going through these, progress as appropriate. It's not a no pain, no gain philosophy. So thank you again. If you have any further questions, you can always contact us at 480-726-3305, and our website is activespinetherapy.com. Thank you. Have a wonderful day.